Welcome to I guess third episode of
We're on our third, yeah.
the Central Virginia Direct Primary Care Show, episode 3. This is Dr. Anderson. I'm Dr. Farrago. I'm wearing this mask only for a minute to kind of show you what we're going to be talking about today. So it is not fun to wear masks. I'm going to tell you right now. I'm going to take it off. Yeah, but explain a little bit. This is our topic of the day. Why are masks so important, Dr. Anderson?
So first of all, you don't want to take it off like Dr. Farrago just did. You don't want to grab the actual mask and yank
Good
it
point.
off because you have theoretically particles that you don't want on your hands, and so you take them off by the strap. So that's that's rule number one.
I want to interject and say I did not even set that up. That's how this is new to me too, and I'm at home, so it's not like I just went out. So we're all okay. But that's great teaching point. So okay, go.
There you go. Sorry, I
Keep
threw you
going.
under the bus there, but
That's good.
yeah, that's how we do them. The science is official. Everybody should be wearing masks. There's been some of these institutions that typically we look to for recommendations have been slow to come to that recommendation because they have to consider a lot other things, namely the shortage that we have nationwide and planet-wide regarding these personal protective equipment, and masks being probably chiefest amongst those for the general population at least. So they're considering all that, but the science is there that everybody should be wearing a mask, period. We're shutting down our businesses and doing quite a number on our economy, all just to slow this virus down. And the science is pretty clear. We wear masks when they're in the hospital to prevent infection. Why aren't we doing it everywhere else right now when it's affecting so much of society? And so that's it.
Give us the four. You had 4 reasons why they work. Go ahead.
Yeah. So the 4 reasons. We got one. People have started looking into more studies about how far particles of this size can travel with a hard sneeze. They can go up to 20 feet. So the social distancing recommendation of 6 feet is not going to cut it for that. So you want to keep whatever infection you have contained to yourself. The second reason is that if you're wearing a proper type of mask, that you should, that it'll help filter out what other people have. We'll talk about that a little more later. Number 3, it keeps you from touching your face, which is how a lot of this is transmitted. We get something on an object. The medical term for that is a fomite. That's some inanimate object that has an infection on it. So like door handles, your cell phones, etc. And then you get it. You don't keep it. Don't get it in your face. Because you have a mask. And then the fourth reason is just a social cue. We're working really hard on social distancing, and if you're wearing a mask, it's a reminder to you and everybody else that we need to do our part. So
I've been talking about masks for a while. Some of the problems with the mask were, hey, they're not filtered. Well, one is we needed to save these masks for the healthcare workers. And in this country, pathetically, we do not have enough masks for healthcare workers. So they didn't want people hoarding them. So we need to make more masks, and somehow that's not happening.
So the recommendation, what I'm reading now, is that if you're not a healthcare worker and you're not in a hospital or something, I mean, they're not letting people in the hospital anyway that don't work there. You can't go there to visit anymore. You should be using DIY masks out of...
So self-sewn, people who are sewing their own masks.
Yeah, that's what they recommend. They don't recommend going out and buying masks or hoarding them because we are desperately in need of masks in hospitals and doctors' offices. I mean, even me as a physician, I couldn't get masks for a while in my own office through these places that always have these in stock. I just couldn't get them. We have them now, but
not many. So, I don't have many. You don't have many, do you?
Not a ton.
Yeah.
We have enough.
I mean, enough for what? So if you start seeing patients regularly, you got to throw them out theoretically every time.
And we talked about this a little bit in our last video, but you can reuse them when you treat them in certain ways with heat and time.
So what do you think about people who have the homemade masks? Will washing it help if it goes through the washing machine?
Yes. So washing it should help. You don't want to throw it in the hamper with everything else and let it mix around with everything. You want to wash it immediately. Something that you can do is you can, like, you can just wash it immediately is what you should do. And ideally have one for every day of the week if you can. But don't use other people's masks. You don't want to be using your spouse's mask or, however else. Don't share. And then if you are reusing masks, like you have one for every day of the week, you can just let it sit in a paper bag for 5 days, and then it is considered clean, because the virus can only live up to 3 days on a surface. And those are usually hard, smooth surfaces like glass. When it comes to more porous things and fibrous things like fabric, they don't even live as long. So 5 days is plenty long.
One of the things I hear, though, is with masks is that they get itchy, you start touching your face. So that's a downside.
Yeah, some people say that. I mean, you'll have to figure out a way so that you can put these around your ears and stuff so it doesn't bother you. Because when I put those on, there's this part of my ear that I'd never noticed in my whole life that is driving me crazy when I have a mask on.
Yeah, they say Vincent van Gogh had trouble wearing his mask.
Because he only has one ear.
Correct.
That's funny.
So let me ask you about hands then. So, should people wear gloves when they go to supermarket?
So yeah, you've seen a lot of people wearing gloves. Some people are wearing cloth gloves. Some people are wearing these rubber type nitrile gloves. That is another thing that can help reduce for similar reasons that the mask. You don't touch your face as much when you're wearing this bright blue rubber thing around it. Okay. And also, but you still need to be washing your hands. That's something that there's been, people haven't, some of these CDC, different institutions that haven't come right out and said, yeah, do rubber gloves. One, we have a huge shortage, so you need to be aware of that. And two, some people aren't washing their hands, and they're just doing everything that they shouldn't do because they have rubber gloves. They think it's okay. You still need to adjust how you're doing things and what you're touching, namely your face. And you don't want to just be wearing gloves everywhere. And so you still want to wash your hands.
All right, let me ask you another question. You talked last about the peak being in May, and I'm hearing that now too. There is a website, and I can't remember I'll see if I can look that up, that actually shows you where the peak should be. I actually think North Carolina peaks earlier, and they're done the way their numbers work out. How is that possible?
They do. They got hit earlier on. I mean, when Washington started having cases, all of a sudden there was a case that showed up in North Carolina. And so from that, there's been a spread. And so they'll peak sooner because they've just been hit with it sooner than we have, their next door neighbors.
Yeah, so let me go to my little anecdotal story of the mask. I went to go to the golf range, and I wanted to get balls. I want to go into the shop. This is 2 weeks ago, or about 10 days ago, I guess. And I had a mask. I said, people are just hanging out. This was before there was an order. And these young guys came out and started mocking me like, oh, too bad I sneezed in there. It's like, okay, this is great. So then I walk in, and some other guy says, who's loitering in there, says, starts mocking me as well. And I said, Italy is having almost 800 people die a day. And he's like, well, this ain't Italy. And I'm like, okay, well, now New York City has about that same many people dying almost a day. This is America. This is the same thing. And I was on top of this mask early, and I never bought into the masks don't work. So we do need to do this because other countries, Israel has mandated masks. You look at a lot of the Asian countries, we look at those pictures, they're so foreign to us that they're all wearing masks. Well, they've been used to this kind of stuff before, and that's probably helped them a lot. So yeah, I do think at the time of this video, there's been no mandate nationally. Trump hasn't said anything. We're hearing whispers that he may mandate it. Not that you can do that, but I don't know. What do you think?
Yeah, well,
what's your thought about when do you? Let me segue into. Think the masks will help. I think the social distancing will help. I think closing down things will help. They were smart. It sucks for the economy. When do you think things open up again? Because I have an idea.
Okay, so I don't know. We're reading tea leaves at this point, but a lot of the models are pointing to maybe June-ish. If you look up some big companies, I think one you had mentioned to me was Disney.
Disney doesn't mess around. They don't mess around. They got too much money on the line. They're not going to wing it.
Yeah.
So if Disney
And
World's
so,
open June 1st, then we just need to hunker down for 2 more months. We can do this.
yeah, I pray that that it'll be a thing of the past here soon.
Yeah. Now your practice is still open. We just talked to you're still seeing patients, but not, you're doing it virtually. So am I, right?
Yeah, yeah, and we've had an uptick in some patients because there's some specialists that they usually see for certain items that they aren't seeing now because they're closed down, and so
And they can't
it's
get
been,
in touch with them.
yeah, and so I have been doing some extra stuff in that regard, just to help them out because specialists aren't available, and so
I'm getting some bizarre things, some patients who we cover for a business, but that they're having trouble getting their primary to even do that virtual visit, and they need some notes, and they won't get to the doctor, and it's like because they're skeleton crew. This is some big facilities in this area, no names mentioned, but that they cannot get through to them. So I will plug direct primary care. There's been some really cool articles that came out in Medical Economics, and then another, maybe NPR just did something, how direct primary care is really worked through seamlessly to handle all their patients, because we've been doing telemedicine when we need to, and we're so accessible because you and I keep, well, we both, our goal is around 600 patients. I started before you, you're almost there. So we have a small amount. That sounds like a lot of patients to people, but it's not. Most family docs have about 3,000 patients. So they can't handle the load that we can handle, because you and I know almost every one of our patients by face and name. It's a family.
yeah, and by voice even.
Yeah.
I know who's on the other side of the phone before they say anything.
Yeah, that's good. So I've opened up. I usually don't let people join unless they come meet me. They're welcome to go on my website at forestdpc.com, and we're letting people join now. BoonesboroDPC.com allows people to join. You and I, just for the public, we're not partners per se. We're professional colleagues, and we're separate organizations that cover for each other. But we both do exactly much. We're the only DPC docs in town do the same thing.
Yeah, it's good. It works out well.
How do you want to end this? Give me something positive.
So, I mean, we are full court press on this. The whole world is working, and we've got some really smart, really dedicated people with a lot of motivation to get this thing figured out. I have been connected with a lot of doctors that I've done my medical training with in school and in residency, and everybody is working on this, and something is going to come out of that much effort, and it's going to happen, and it's going to bring us together as a world, and it's neat that there's this battle that we're fighting, but we're not fighting each other, and so it's neat to see how things are changing and how people are being so human and so strong.
It's a great way to end it. I ditto that. Let's talk again next week. Keep this going. All right. Sounds good to you?
Sounds
All right,
good.
man.
Thanks.
All right. Talk to you later.